Sure, Nirmala Singh, National Kidney Foundation, headquartered in New York City. For me, working in the patient advocacy space, obviously it's about creating a cycle, a program life cycle where the patient is placed at the beginning of that. The patient is telling us what they need, what their desires are, and before we go out for funding, before we look for development, we're asking them those questions. The patient is the end user. They're the consumer of the drug. If they take a more engaged perspective, then they're going to have the quality of life they desire by speaking up, informing, and engaging in their own healthcare and taking the control in their hands. Any patient who's looking to be involved in patient engagement, whether it's through technology, whether it's through advisory, whether it's through policy, I think it's improving their quality of life, extending their lives because of the drugs that are being developed with their input. I think care is going to be a partnership model. It's going to move away from that patriarchal, parental type physician-patient relationship. I think their care is going to be more in their hands, and they're going to feel more in charge of what they can do, in charge of what they decide on, and it's going to be a shared decision-making process. What is trying to be done on an international level and then implementing across the board at local, national levels, I think it's really something new, something novel, and something that is really needed. It's across stakeholders, it's across different industries, and it's really bringing the players to the table, and I think that's very, very inspiring.